My name is Dr. Shah. I'm a board-certified plastic surgeon with a subspecialty board certification in hand and upper extremity surgery. I'm the chief and medical director of the Center for Hand and Upper Extremity Surgery. So with arthritis of the hand, you can get arthritis in pretty much any joint that exists. The most common forms of arthritis in the hand are what's called DIP joint arthritis, which is at the tip of the finger, base of the thumb arthritis, which is also known as CMC arthritis or basilar joint arthritis, or even arthritis at the wrist level in different areas where the wrist cartilage may have worn out. The main symptom for arthritis is pain. When the cartilage surface has worn away and there's bone-on-bone grinding, it causes a significant amount of inflammation and dysfunction and sends signals to the brain that says this joint is abnormal and it's hurting. Over time, as the arthritis gets worse, it can actually lead to deformities in the areas of the joints themselves, where you may get some overgrowth of bone, some malposition of the bone that becomes more and more dysfunctional from a movement standpoint. If you're a patient who believes that they have significant arthritis in the hand and has a significant amount of pain and dysfunction, the first step to diagnosis is coming to see a surgeon or a provider at the Center for Hand and Upper Extremity Surgery to get checked out. When you come into the center, your surgeon will do an evaluation and an assessment of your pain, your dysfunction, some of the different activities that are being affected by your arthritis. They'll then do a physical exam where they actually test the joints themselves to see if there's a significant amount of pain at the area of the bone-on-bone grinding. And then usually the next step in the process is to obtain x-rays. At other institutions, you may have to get a prescription for an x-ray somewhere else. At the Center for Hand and Upper Extremity Surgery, your surgeon will actually do your x-rays right there so you can get some real-time feedback to see whether or not you really do have arthritis at that location. At the Center for Hand and Upper Extremity Surgery, the treatment for arthritis is a multimodal treatment plan that's specifically tailored for your specific problem as a patient. The treatment can entail from something as simple as physical therapy and bracing, some conservative treatments like oral medications, topical medications. Your surgeon may recommend to you that you get a steroid injection. At the center, we actually have doctors that specialize in image-guided injections so that the accuracy of the injection themselves is much higher, and therefore you'll end up with a more significant amount of potential relief. In severe cases, some of these conservative measures or injections won't be enough to treat your pain, and then your surgeon may talk to you about different types of surgery in order to treat the arthritis, get rid of the pain, but also preserve your function so you can get back to your life in a rapid and reasonable fashion. If you're a patient that needs surgery to treat the arthritis within the hand, there's a whole lot of different options in order to treat the problem. For example, joint denervation is something that exists in order to remove the nerve supply from the joint without affecting the joint itself. It's a much less invasive surgery than your traditional procedures for certain forms of arthritis, much more limited downtime, return to function more quickly, all while providing you opportunities to have your pain improved. Some of these different types of treatment will be offered to you at the Center for Hand and Upper Extremity Surgery, and your surgeon and you and your family will come to a joint decision about what makes the best treatment for you. Nearly all surgeries for arthritis in the hand involve a same-day surgery in which you go home as soon as the procedure is completed and you've had time to recover. But the different types of surgery will involve different types of long-term recovery. There may be times in which you are set up with a physical and hand therapist early on in your recovery, and there may be other times where you have a cast or a splint on for a period of time before you start motion. If you're a patient that's had a joint denervation performed, you'll experience significantly less downtime than if you had one of the more traditional procedures that was performed. We want you to be treated for arthritis at the Center for Hand and Upper Extremity Surgery because we have an option to offer you all of the different types of treatment that exist for arthritic conditions. We have a multimodal integrated team that may treat you with conservative, with injections, or even if you need surgery, we have all of the variety of options, including things that are less commonly found, such as joint denervation surgery. We want to give you as a patient an individualized treatment approach to make sure that we're not trying to offer you a one-size-fits-all, everyone should have this specific procedure.